Hello, today, we are going to talk about nursing management of malnutrition. This is a life-threatening situation that occurs when the body lacks both essential and non-essential nutrients. Chemical of the body, causes 1. Inadequate or imbalanced diet e.g. protein energy malnutrition (PEM) or vitamin deficiency, 2. Malabsorption or indigestion problems, 3. Certain medical conditions e.g. inflammatory bowel syndrome, 4. Starvation for a long period of time, symptoms, fatigue, dizziness, weight loss. Nutritional assessment methods. 1. Anthropometric, including checking weight and height for body mass index calculation. 2. Biochemical method, which involve lab work e.g. serum electrolyte levels, mineral levels. 3. Clinical method, where a quick outlook is given by a health worker depending on the status of the patient, which may be visible on quick examination. 4. Dietary approach, where the patient is questioned on the diet she has been for the last 2 days to evaluate on balanced diet. 5. Economical method, where a patient is evaluated according to her financial status and ability to purchase food essential for balanced diet. Forms of malnutrition. A kwashiorkor, this is a form of malnutrition that occurs as a result of lack of proteins in the diet. Symptoms: changes in hair and skin texture and pigment, decreased muscle mass, diarrhea, consistent weight loss, reduced immunity, fatigue and lethargy, protruding belly. B. Beriberi. This is where the diet taken lacks thiamine, vitamin B1. There are 2 forms of beriberi. 1. Wet beriberi affecting cardiovascular system. 2. Dry beriberi affecting central nervous system, also known as Wernicke-Korsakoff syndrome. Symptoms of wet beriberi: tachycardia, shortness of breath during activities, edema of the lower limbs, awakening at night with shortness of breath. Symptoms of dry beriberi: difficulty in walking, peripheral neuropathy, paralysis of extremities, mental confusion, strange eye movement, nystagmus, tingling, vomiting. Complications of beriberi: square root coma, square root congestive cardiac failure, square root psychosis. C. Rickets. It's a disorder caused by lack of vitamin D, calcium and phosphate ions. It may lead to softening and weakening of bone. Symptoms: bone pain, dental deformity, impaired growth, increased bone fractures, muscle cramps, bowlegs, spine deformities. Complications: square root chronic skeletal pain, square root skeletal fractures, square root skeletal deformities. D. Scurvy. This is a disorder that occurs when one has severe lack of vitamin C, ascorbic acid. It may cause anemia, hemorrhage, gum disease. Laboratory tests and examination for patients with malnutrition: arterial blood gas, serum electrolyte levels, bone X-ray, serum alkaline phosphate, parathyroid hormone level. Definitive management of malnutrition: stabilize the patient by correcting dehydration through IV fluid infusion. Correct micronutrients deficiency by providing a food rich in vitamin A, e.g. fruits and vegetables. B. Multivitamin or supplements such as ready-to-use therapeutic food RUTF. C. Folic acid tabs 2.5 mg ODD. Iron-containing foods. Correct electrolyte imbalance by infusing mineral mix and potassium orally added to feeds. Correct hypoglycemia by proper feeding with balanced diet. Treat any underlying medical condition if possible. Replace the missing nutrients needed and treat any symptoms showing out. By Jones HMMBA, DMS.